Good afternoon, everyone. Thank you for joining us for today's webinar. My name is Melissa Dano, and I'm the Dietetic Internship Director at UT Health Houston School of Public Health. The Michael and Susan Dell Center's vision is healthy children in a healthy world, with a mission to advance health and healthy living for children and families through early and impactful interventions. Information about the center's work and resources can be found online. The slides and a recording of today's webinar will be archived on our website, msdcenter.org. If you have any questions during the presentation, please enter them in the Q&A box. Before we begin, I'd like to take care of a few housekeeping items. Today's presentation was approved for one contact hour of nursing professional development provided by the Cizik School of Nursing at UT Health Houston. Please see the requirements for receiving credits listed on this slide. Additionally, there are no conflicts of interest to disclose with regards to the CNE activity today. We will share more instructions about continuing education credits at the conclusion of this webinar. Additionally, this webinar offers one entry-level MCHES credit and is pending CDR review and approval for one CPEU. Okay, so to continue with that, I will introduce our speakers. Dr. Mahadevan has practiced pediatrics for more than 8 years and is also trained in shared medical visits, nutrition, clinical hypnosis, and mind-body medicine. She is boarded in pediatrics and integrative medicine and joined UT Health in May 2024, where she has a joint position in the UT Department of Pediatrics Community Division and at the UT Health School of Public Health to help drive their culinary medicine program. Dr. Fernando, aka Dr. Yum, is a pediatrician in Fredericksburg, Virginia, and founder of the website dryum.org and the Dr. Yum Project. For 10 years, she was the owner of Yum Pediatrics, a full-service general pediatrics practice featuring a large teaching kitchen and teaching garden with the Dr. Yum Project. She is also co-author of Raising a Healthy, Happy Eater and Dr. Yum's Food Adventure. She is a fellow of the American Academy of Pediatrics. Most recently, she authored Touch Points, an intensive health, behavior, and lifestyle program for healthcare providers to teach lifestyle behaviors to pediatric patients and their families. And now I'll hand it over to Dr. Mahadevan and Dr. Fernando with the presentation on Nourishing Beginnings, Fueling Healthy Futures in the First 1,000 Days of Life.
Good afternoon, everyone, and thank you for joining us today. Dr. Fernando and I do not have any financial relationships or disclosures. I will start with our learning objectives and really discussing, why it is so important to focus on the first 1,000 days of life. We know that there are key nutrients mothers need to have for babies to grow and develop properly, and want to touch on that. We also know that there are key strategies to introduce solid foods in a very sequential way to promote healthy eating in toddlers and babies. And the next thing we'd like to do is really describe the tools and resources you may have in your community and surrounding areas to provide continued support for both mothers and babies when it comes to healthy nutrition. So when we think about the first 1,000 days of life, we really need to think about how this is a time of rapid brain development. And baby's brain grows faster in this period than any other time in their life. And really, nutrition sets the foundation, and the nutrients for the mother during pregnancy is so important for the baby's immune system and cognitive health to be robust. And when we think about malnutrition, this can often be causing weakened immune systems and further poor brain development. When we think about how a baby and a mother bond during early bottle and breastfeeding, we know that's so important for emotional regulation, for a child to develop in a positive way, and also to have less stress. And when we also think about the first 1,000 days, we know how important it is for children to eat the rest of their life. There's more and more studies to show the flavor taste profiles can begin as early as conception, since whatever mother is eating is passing through the amniotic fluid and placenta, and she really has such an opportunity to create healthy, nutritious patterns for her babies to come. And when we think about the maternal diet early on in pregnancy, we know that the microbiome is where 80% of the immune system lies. And baby's first exposure to microbes comes from mother right in the womb through that placenta. And so we know a healthy gut really plants the seed for that baby to have beneficial bacteria and aid with digestion, metabolism, and growth. And the maternal microbiome, if balanced, reduces inflammation and increases immune activity overall. And we know that maternal robust microbiomes have lower risk of gestational diabetes, excessive weight gain, and other health issues. And of course, an unbalanced microbiome in pregnancy can lead to increased pathogen development as well as a poor immunity for baby. So the microbiome influences nutrients in so many key ways, and especially new studies show that the microbiome also has a big impact on allergens and post-allergens after birth. So eating probiotic and prebiotic rich foods not only help that beneficial bacteria grow, but the microbiota can really develop a diverse pattern of eating. So mothers really need to focus on eating fiber-rich foods, vegetables, fermented foods, limit antibiotic use, and really focus on extra physical activity. And when we think about maternal nutrition, it's so important. One, because folic acid helps form the neural tubes, which of course becomes baby's brain and spinal cord later on. We know that adequate folate development is so key to prevent all neural tube defects, such as spina bifida. And we also know that folic acid helps support DNA synthesis. So mothers really need 400 to 800 micrograms daily. And of course, when we think about iron, we know that hemoglobin is a protein. RBCs carry oxygen and prevents maternal anemia. And we know when mothers have maternal anemia, they're often fatigued and they're often weaker as well. So if a mother is getting her recommended iron, which is 27 milligrams per day, she can really help support herself and her body throughout conception. And of course, iodine we know is essential for thyroid hormones, which of course regulates metabolism and is critical for brain development as well. And then when we think about DHA, right? So that's important for the brain. It's important for vision because it helps develop the retina. And we know that structural fat is truly needed because it's important for cognition. And there are some studies to show that DHA can also support decreasing postpartum depression later on. So making sure mothers are eating fatty fish, making sure that they're getting their adequate DHA, which is about 200 to 300 milligrams per day. A great paper came out, Partnership for a Healthier America, with Dr. Fernando and I are both a part of. And this white paper was critical. And it said that the early years are a critical window to develop taste preferences in early childhood. And it's so key to cultivate vegetable acceptance early on. We know that 10% of children eat the recommended vegetable intake, but we also know that the taste is malleable and repeated exposure is so key. But most important, repeated exposure early and often, and variety matters. It's not just about quantity, it's about children developing a taste for textures, flavors, and colors, and really allowing them to have a broader nutrition profile early on. And we also know that modeling makes a difference, and caregivers are so essential and influential in that role. And of course, not giving up. Kids are malleable as well. And, their taste buds can change and they have certain receptive buds for certain foods. But giving that variety is really key to success. And the frequency of vegetables matters. So when the white paper came out, there were truly key audiences PHA was looking at. One was, of course, the food industry, looking how is baby food processed? How is it given? We know that initially there's such a focus on starting baby food companies with fruit-based baby food jars. And PJ was really making a focus. Let's promote those baby food companies that do vegetable first foods because we know that's so key. And of course, early childhood education. Dr. Fernando does a lot of work with Head Start, and we know that our educators are so key to encouraging healthy nutrition in babies and toddlers. And then, of course, there's medical professionals like ourselves, right? As pediatricians, we have such a role to play when it comes to families starting solids, and it's so important that we're all on the same page because the feeding trajectory early on we know makes a difference later in life. Just this morning, we were given a beautiful grand rounds on pediatric hypertension and how early childhood eating of healthy foods decreases morbidity and mortality of cardiovascular disease later on in life. And so, as health professionals, product development is key and not something we talk to as much, but we really know that more vegetables promotes better and healthier trajectories when it comes to weight and BMI as well. And when we think about what PHA did after this white paper, is they brought together a group of pediatricians, speech therapists, registered dietitians, and then consulted with allergists to come up with these feeding guides that Dr. Fernando will go in detail over the next few slides. But these handouts are free, they're on the PHA website, and they're a great guide for not only parents, but health professionals as well. And one of the key players in creating those guides was Melanie Patak, who is a speech therapist. And she has found through her research that feeding is such a developmental process. And this really struck home with me just a few weeks ago in clinic. I had a 12-month-old come see me, and they were not saying any consonants, any vowels, and not babbling either. And when I asked mom, hey, what's going on? How is starting solids going? What has the baby eaten? She looked at me and she said, oh, I haven't started solids yet. And we really went to in-depth reasons as to why that was. And there were so many barriers that she had. But what's ultimate is we know that a baby's development and how babies eat is also in conjunction with their speech because we need the muscles of mastication in order to really build our palate or in order to be able to say certain syllables. We also know that we use the tongue not only to eat, but to say certain words, to say certain consonants. So every handout that was done is also about boosting feeding developmental skills and what a patient can do and a mother can do in each area to really build those solid feeding skills. And of course, when we think about capturing the flavor window, we know that the flavor window is early in childhood, and it's truly a critical period when babies and toddlers are especially open to trying and accepting new tastes and flavors, such as vegetables, whole grains. We know that the taste preferences for all babies across the board, they're born preferring sweet foods, and they are born rejecting bitter flavors. And this is just an evolutionary trait for survival. But we know from 4 months to 18 months, if we capture that window, the brain and the palate are highly adaptable. And repeated exposure allows babies to truly not only enjoy new flavors, but they're less likely to reject it later on. And we also know that it can take 8 to 10 times for babies to be receptive to certain foods. So just because they don't like it the first time does not mean that we've not been able to capitalize on that window. We just have to keep exposing babies to it over and over again. And we know that this period is critical for dietary diversity, and it's really essential for nutrient absorption as well. So as healthcare professionals, as health educators, we really have a role in priming our infants to recognize and accept these flavors. And of course, when we think about family foods, a small study found that repeated exposure to commercial baby food did not generalize to homemade versions. So essentially, what does this tell us? Babies learn very specific flavor profiles. So when they're exposed to a particular product, they become familiar with that particular product and that combination of taste, aromas, and texture, but not necessarily the broader food category. So learning to like peas means learning to like that version of peas, unless they're exposed to multiple different versions. So when we think about commercial baby foods, they often have smoother textures. They're heat treated. They can often reduce the bitter flavors. They're often added with salt or mixed with fruit, and they're blended with other things. But homemade versions usually tend to have that more intense flavor, the more natural flavor, that more uniform texture. So it can really surprise infants because it's not as mild of a taste. So to truly develop a taste for food groups, they need to be exposed to that food in so many different ways. And that truly is one of our goals from the resource guides, to be able to cook, puree, mash all the different foods so babies know how to taste those. And of course, some foods we know take practice. And many foods, especially bitter, sour, complex flavors, umami flavors, spicy flavors, they truly need repeated exposure before babies can learn to truly enjoy them. And we know this is normal, and we also know that it's part of development. And making a face does not mean they don't like it. And so when we think about how some foods take practice, the biggest thing I see in clinic when I talk to my picky eaters is they do not like green vegetables. Broccoli, spinach, kale, they just are not a fan. And one of the reasons is they naturally tend to taste bitter or a little bit more earthy and grassy. So developing that palate and developing a taste preference for it truly takes practice. And the other thing is cruciferous veggies, right? Your cauliflower, your cabbage, your Brussels sprouts. They tend to have a little bit bolder flavors with stronger aromas, but when babies are exposed to it early, they're much more adaptable to eat it later on. And then of course our root vegetables, right? Like parsnips and turnips, they're also less sweet and more earthy, so exposing that to babies is so key. And when we think about a family approach to vegetable intake, I can't say enough about modeling and having a garden, taking your kid to the grocery store, having them pick out vegetables they like, trying new foods, really making it a family matter. Cooking a new recipe that grandma passed down, right? We know that modeling is one of the key factors in getting children, infants, and toddlers to eat well. When a toddler sees a sibling eat well and take a taste and try something new, that child is more likely to do it as well, because children copy what they see. And if parents and siblings are regular eating and enjoying vegetables, children are more likely to try it hands down. And studies show that simply adults eating vegetables increase a baby's willingness to try it. So, sharing that preparation truly builds ownership, and involving children in the food process and the cooking process, washing service, not only increases their curiosity, but increase their acceptance to certain foods as well. And then having that positive food environment also helps with long-term habits. And a home where vegetables are so visible, right? There's a basket on the island, or there's an herb garden close to the house, that really creates those lasting associations without bribing of and enforcing, of course. Next one. And then, of course, shared family meals. I know my colleague, Melissa Danaho, and I did another webinar on shared family meals and how this plays such an important role for child preferences. And we know that eating a meal together, everyone in the household is more likely to eat more vegetables when you share a meal together. And this is predicted in so many different beautiful studies. Eating together allows children to normalize healthy eating, to normalize how vegetables are half your plate. And sharing meals also a time to connect as a community. And we know that parents' preferences and access influence children as well, right? Parents who eat fewer vegetables or rely more on processed foods, kids see that, right? And I had a mother in clinic, she keeps all the junk food, she told me, in her room. So at least the kids can't see it in the pantry. And one of the conversations we had is, once she starts showing the children how eating carrots and vegetables and celery is important and hiding the bad food almost made it felt like a reward. She started to see those associations, and wide vegetable intake truly benefits everyone in the household. And it's important to normalize that repetition and exposure. And just again, emphasizing modeling is one of the key takeaways that we know makes such a difference. So when children come into clinic and parents are describing picky eating and their frustration, or have a child with constipation because the lack of fiber in their diet, truly one of the best things that can happen is a whole family starts to eat better and increase their vegetable consumption, from dads to siblings to friends. And we know, right, a community that eats well is so important when we think about even the blue zones, when everyone is modeling a healthy environment and truly has a beautiful impact on that child as well. And of course, feeding guidance, they have changed so much throughout the years. And 50 years ago, we used to start with rice cereal, and that is no longer the recommendation. But I think what's important to take away of this, 1900 to 1950, we were so focused on malnutrition. We were really pushing calories, calories, calories more than anything else. 1950 to 1980 is where ultra processed food started, and we really started using more processed foods when it came to cooking. And it's not until fast forward today, we're going back to the importance of responsive eating, and from baby-led weaning to purees, and all the different ways we can guide families on healthy eating is so key. And because we live in a melting pot of a society, there's so many different cultures that do different things, and there's such a generational divide in understanding feeding recommendations. And because there's been huge changes across the years, it's so important that our primary goal should be the same. And that's, of course, how to introduce solids, how to focus on vegetable and fruit intake. And of course, we've moved away from survival to really thinking about, okay, let's focus. If we do have commercial baby food, how can we purchase foods that are a little bit healthier? And now we're going back, of course, to breastfeeding and food safety and back to sleep. And early on in 2000, we used to say wait to introduce allergens in baby's foods diet. But now we're saying, hey, allergen foods, which Dr. Fernando will talk about, need to be introduced early. So flavor learning is where we are today, and early allergen exposure as well as diverse flavors. And I'll kind of just end this section on how important it is for pediatricians, especially, to focus on standardizing our introduction to starting solids. So this is something we're working at from the level of AAP, the section of integrated medicine, and the branch of culinary medicine. If we can standardize guidelines of how pediatric residents, pediatricians are talking about how to start solids, then we can help influence families at a greater level. And when we all are saying the same messaging, it really helps our children thrive, because one, consistency matters, and standardizing guidelines we know is so important based on things like the white paper and based on all the data we have on how nutrition is so important early on, really because it's optimal for growth and it prevents nutrition deficiencies later on. And just again talks about that again. So a shared framework is key. And when health professionals are unified together, from health educators to pediatricians to even the food industry, we know children are more likely to adopt safe feeding practices. So I'll pass the baton now to Dr. Fernando.
Thank you. Over the years, and just want to make sure you can hear me. Is everyone hearing me, Rupa?
We can hear you now.
Okay, great. So yeah, just a little bit of context. I mean, in 1972, my parents came from Sri Lanka, and my mom delivered me, and she was the only woman in the hospital who was nursing at the time. And the nurses in the hospital actually discouraged her from breastfeeding. And then when it came to solid foods, she was really faced with a lot of unfamiliar advice about starting purees, much different from her own cultural experience. And I think about how many families experience that disconnect as well. But fortunately, guidance has changed, and we've seen a real shift in how parents are introducing foods. And we've seen the science evolve too. Things like introduction of allergen food has really changed with studies like the LEAP study. So it's been really fun over my lifetime and my career, my parenting journey, and as a pediatrician to see sort of a full circle moment. This is actually a picture of some babies in one of my baby food classes at my teaching kitchen, where I went back to a family recipe, a Sri Lankan recipe, and showed families that yes, kids can eat some of these cultural foods, rich in spices, rich in textures. And families really enjoy seeing that their babies can be these little foodies almost. Next slide. Perfect. So it's nice now, as Rupa said, to have sort of a standardized set of guidance that families can share also. And I found in my own practice, it's really nice to have a resource that families can take back to other family members and bridge a little bit of this generational divide that we see, where parents, grandparents, nannies may have had not so similar feeding experiences, but this is a way that we can get everybody on the same page. So I've enjoyed being able to share that resource with families and have them take it back so everyone can kind of be on the same page in terms of feeding. I put a QR code on here too if you are interested in going into the Dr. Yum website and seeing the guides and some other resources around early feeding. Next slide. So I'm going to go through the whole series with some key takeaways. The first is the overview guide. This is really just a guide to sort of introduce the two collaborating organizations that put this guide together and introduce our multidisciplinary team. We all come with our own varied sets of experience. We know the frequently asked questions, and we really worked as a team to answer those questions in these guides as well as we could. We even had sensitivity reviewers. The whole series is translated into Spanish as well, just trying to make it as accessible and easy for all types of folks to be using, both in pediatrics and early care and education in public health settings. Next slide. So the first guide is really a prenatal guide, and Rupa talked a lot about this prenatal period. I will say from a pediatrician standpoint, it really is nice to have a guide like this that I can lean on when I'm seeing lactating mothers, when I'm seeing prenatal visits who are coming to the office to get to know the staff. And they have questions about what they could be eating to make sure they're optimizing their baby's health. So this is a great guide. And we had a dietitian who's really specialized in prenatal nutrition who led the writing of this particular guide. Next slide. The next guide is a 1 to 4 month guide. And this is where we really start to set the stage about a concept called responsive feeding. And that's really being aware of a baby's cues and following those cues in terms of their hunger and fullness. And that can start in this period before solids, when baby's nutrition is coming primarily from breast milk or formula, there are things that we can do to start taking those cues so that we don't necessarily over or underfeed, but we're letting the baby sort of set the pace. And that's something that sort of is apparent too as we're going into further into this series. You'll notice that responsive feeding strategy working also for when we start solid foods as well. There's a lot of questions that we answered here about this particular age group in terms of development. So Rupa mentioned the boosting feeding development. So of course, we're not doing much beyond breast or bottle feeding, but we're setting some of these foundational skills that babies are going to need in the next few months as they start solids. For instance, their gross motor skills are going to be very important in sitting up in a feeding chair. Their fine motor skills are going to come into play when they start self-feeding. So we can be building these skills prior to solid food introduction to set the stage for good feeding skills later. Next slide. The next guide is a 4 to 6 month guide, and this is when we want to make sure that we're not jumping the gun in terms of solid food introduction, because as we said, guidance has changed. Even when my own adult children were starting solids, we started right at the 4-month mark. But we've evolved and our understanding of readiness has evolved. And so typically we guide families to start at around that 6-month mark. So we talk about looking for those signs of readiness. Are they sitting in a feeding chair independently? Do they have the gross motor skills? Do they have the interest? And so again, we're working on these developmental skills and we're looking for these signs of readiness. And we're starting to explore this idea that when we start to have these tastes, as Rupa said, sometimes these bitter tastes may elicit a little bit of a face, right? And that's okay. We want to make sure that parents know that repetition, especially for these more challenging flavors, is super important. Next slide. And then in the 6-month guide, this is really where parents have a lot of questions, because it's typically at that 6-month mark that we're introducing a lot of new solid foods. And there are a lot of questions too about feeding trends, like for instance, baby-led weaning, which is a way of feeding babies that really prioritizes less smooth foods and more solid food introduction and texture. And parents have a lot of questions about that. So we really put a lot of care and attention into this feeding guide. It's probably our most robust guide. We talk about those feeding development skills, and I think it's really important to mention, we even talk about how to optimally position a baby in a feeding chair so that they feel comfortable, so that they're not spending a lot of time engaging their core muscles, that they feel supported under their feet, behind their back, so that they can focus on eating these new and exciting flavors and textures. We also talk about high allergen foods. As we mentioned, the pendulum has swung back to understanding that high allergen food introduction early may actually benefit babies and lessen the risk of food allergies later. And so we talk about in this guide how we do that, what those food allergens are, and how we can get started with them. Next slide. So in this guide, we've actually, in our version 2 of this series, we've added this food safety tips section into our 6-month handout so that families can see how you can introduce texture, how you can introduce those high allergen foods, and then what can happen when we introduce texture. We talk a little bit about choking versus gagging. As we're introducing texture, it is very natural for babies to stumble a little bit and have a gag response. And gagging can be a little bit scary for new parents who are watching their babies struggle or learn texture. And so we try to assure parents that gagging and choking are two very different experiences and how to recognize one from the other. So that if you're seeing an occasional gag, we're not stopping the learning process, but we are maybe adjusting texture and helping that baby get through learning new textures effectively. Next slide. And we've added to this, this handout real detail on what is safe in terms of texture for babies. So Melanie Potok, as Rupa said, was really helpful in understanding from a feeding therapies perspective what is really safe and what is really appropriate to be introducing at this age in terms of those developmental skills. So we have these visuals to help parents to recognize what kinds of textures they can be starting in the 6 to 9 month age group. Next slide. And then the top 9 allergens, they can be hard for a lot of families to remember. So we actually, in this new version of our handouts, we included a guide, which you'll see in the next slide, which actually names those food allergens in a chart form. And so that way parents can keep track of what foods they have introduced, maybe what date they've introduced them, and we even give some detail as to how to introduce those foods in a way that's safe and appropriate and palatable. So you'll see in the next slide what that chart looks like and how we can, parents can actually write down what it is that they're trying, what they've tried, and then what those allergy responses might look like. If a family is seeing a food allergy, what does that look like? And they can even mark that down so then they can take that chart to the pediatrician and review with them what they're seeing. And if you advance to the next slide, you can see what that chart looks like. There's room for families to make little notes too. So this can be super helpful. There's a lot for parents to remember, and sometimes it can be hard to remember when and how those high allergen foods are introduced. So this keeps it really organized for families to then take. Next slide. Okay, thanks. Iron-rich foods are very important, especially for breastfed babies. So formula typically is iron-rich, and breast milk is naturally less rich in iron. So we want to make sure that babies, we are prioritizing the iron-rich foods like meats, legumes, fish, beans, tofu, green veggies. And of course, iron fortified cereals can be a healthy part of an infant's diet, getting those that essential iron that's needed for brain growth and development. Next slide. And then, of course, going back to encouraging cultural foods, recognizing that there are varied cultural feeding practices, and there is a way for families to really use culturally appropriate foods in the early feeding space. And we really encourage that diversity. Kids have a really wide plasticity in terms of their the way that they're interacting with these foods and developing these preferences. So why not take advantage of the flavor window and include a wide variety of flavors as well? Next slide. The 9 to 12 month guide is really when we start to see a lot more independent eating. Typically. So we want to make sure that babies are starting to self-feed, that they're exposed to a lot of opportunities to eat different finger foods, that we are allowing them to, using that responsive feeding model to encourage babies to show those signs of readiness and self-feed, take feeding into their own hands, really. It is very tempting for families that I see to start to rely on some of the pouches, and because we're seeing a lot of that pouch preparation really cater to toddlers now, but really babies at this age should be using their feeding skills, using those muscles of mastication and practicing feeding. So we want to make sure that families aren't relying too much on pouches for everyday feeding, but using them more as a supplement. And then we want to make sure too that we're not overall relying on too many toddler snacks. A lot of commercially available toddler snacks may have too much salt and sugar for babies. So we want to be discerning when we're relying on toddler snacks, especially everyday use of toddler snacks. And then we really focus a lot on cup drinking skills as well. Typically, as pediatricians, we recommend weaning from the bottle at about 12 months. This is really helpful for optimal oral motor development. So we talk about cup drinking skills and how to safely introduce the cup so that babies can do that wean at 12 months. Next slide. And then our toddler guide, which is really the 12 to 24 month guide, is another very robust guide. And the reason for that is this is where we can see a lot of challenges around feeding. As Rupa said, there is a big flavor window. And if you think about an infant who is trying something sour, they may make a face, but then they go in for more. They're just naturally hungry. They're growing very fast. They're growing in pounds. Well, toddlers grow in ounces. They're growing much slower. Their metabolism is slower. And so they naturally aren't as hungry and they are much less interested in food. So we want to make sure that parents recognize that it might be that you're seeing less robust eating. We're not seeing 3 big meals that a baby is finishing really eagerly, and that's okay. So we want to manage expectations. And so we talk about how we can offer a wide variety of foods, but it may be that a toddler isn't necessarily hungry at every meal that we offer. Next slide. So I talk a lot about Ellen Satter's, the dietitian Ellen Satter's guidance, which she calls the division of responsibility when it comes to what parents need to do at meal times and what the child's responsibilities are at mealtime. And this can be very, very helpful for toddlers. So parents really, their job is to decide what to eat, when to eat, and where to eat. So for toddlers, we're offering a wide variety of foods. We're putting that food down at mealtime. And then we're letting the child have their responsibility, which is they get to decide whether they're going to eat and how much. And if we can follow this division of responsibility through the toddler months, it can make it a lot less frustrating for parents and children. Next slide. It can help also to set a feeding schedule during these months so that we can allow hunger to develop, because often we see toddlers sort of wanting to graze and snack. And so when we get to meal times, they may not have the hunger that will drive them to try that variety of foods that we offer. So it's important that we have breaks from feeding, and I call those growing times, where we can work on other developmental skills and really develop hunger. Next slide. It is important, though, as we're starting to see some behaviors around feeding that are stressful to parents, that we really take the time to listen to parents, because some toddlers may really have a much more limited palate than other toddlers, and it's important to recognize and acknowledge the frustration or stress that families might be feeling. And so I have a child is whether a child is maybe at risk for a feeding disorder and might need a feeding evaluation. So for infants, it might be excessive gagging, inability to advance past purees, not initiating self-feeding, and a baby that may not be growing according to the growth curve. And then for toddlers and children, it may be that they're very limited in the kinds of foods that they will eat. And this creates a stress around mealtime. So I think as practitioners, it's important for us to listen to our patients and their parents and offer that feeding evaluation if we think that they are outside of the bell curve of normal eating for that age. Next slide. And then this is just lastly to remind us too that for children, cooking and experiencing food with all of our senses is a wonderful way to establish a joyful approach to nutritious foods. And as Rupa said, I work a lot with Head Start programs across the country. We have a program that is really geared for 4 and 5-year-olds in Head Start. It's a culinary adventure where kids are experiencing fruits and vegetables in the classroom and cooking them together as a class. And I have noticed over the years that many of our early Head Start teachers who have students that are 18 months to 3 years actually are very interested in getting their kids on the adventure. So we've seen that even these young toddlers are able to, in some way, experience the joy of being part of cooking preparation. And that really sets the stage for them to try some of these foods. It makes it a lot easier as they progress into the 3s, 4s, and 5s classrooms. Next slide. I wanted to leave you with a couple of resources too that you could look at. One is we have a lot of recipes on our website at the Dr. Yum Project, dryum.org. These are recipes we've tagged as baby food option recipes. So they're family recipes that can be adapted for a new eater. So like Rupa says, the family table, shared family meals can be accomplished with a slight modification to some of these family recipes to make them safe and palatable for your youngest eater. Next slide. And then we also have another tag on our website called the WIC food package tag. These are recipes where 75% of the ingredients are on the WIC food package. And we're just updating all of those recipes now for the new updated WIC food package. And that can be a great resource for families who are on WIC, the WIC program. Next slide. I'm going to pass it on to Rupa now to finish us up.
Alrighty, thank you, Dr. Fernando. That was so helpful. And, just to end our talk today, what we know when it comes to resources is it's so important to empower families and build their skills. And whether that's cooking classes or, community collaborations, bringing families together really makes a difference. And I think one of the reasons centering where we brought prenatal mothers together worked so well is because we did it as a group and everyone got to learn from each other. And there's a lot of different pediatric practices out there that are now doing the 4, 6, 9, 12-month-old visit as a group visit with a registered dietitian because it gives an opportunity for families to ask so many questions about solids and starting solids and food allergens, learn from one another, and then also have an expert in the room, which is so valuable. And then, of course, knowing your food access programs for your patients, for your families is important. Knowing what the food pantry offers, what food pharmacies patients have access to, where they can use their SNAP benefits, using your waiting room wherever you are, whether you're a health educator or a health professional, doing culinary medicine demonstrations is up and coming, and doing interactive cooking sessions or cooking something at home and bringing it to your work of choice and having people share a meal and eat different types of foods really can create a more productive food environment. And patient education materials, of course, there are the handouts that Dr. Fernando describes. There's also wonderful websites that I'll discuss in just a second, but really providing families with recipes, with nutrient-dense snack ideas. Going to the Dr. Yum website can be so helpful, and community outreach really helps connect families. with local support groups. So WIC is a wonderful resource for our families, and there's apps out there that you can figure out which foods are at different WIC sites and how you can create a more nutritious recipe with those foods. Of course, Head Start is a beautiful program. Common Threads is another program in different cities in the country. Healthy Children is created by the AAP. It's a wonderful resource as well for nutrition and nutrition deficiencies, more specific as it relates to health. MyPlate.gov always has great meal ideas. Solid Starts is a wonderful app that I talk to a lot of families about who are interested in baby-led weaning or how to start solids, because it goes and it shows different pictures by age group, and it has a lot of practical resources. Local resources in Houston, of course, our Nourish program with our teaching kitchen here at UT School of Public Health, our Brighter Bites program, food pantries, and of course, hospital-based culinary cooking classes. But we're, of course, happy to be a resource for you as well. And then for Dr. Fernando, who's also a UT grad, visiting her website, Mealomatic, can really be helpful when providing information to families and establishing good habits, because eating well is truly a lifestyle change, and getting the family involved is what makes the most difference. So I will now pass the baton to Ms. Danho.
Okay, thank you so much, Dr. Mahadevan and Dr. Fernando. That was fantastic. We will now answer some questions from our audience that were submitted during the presentation. And just a reminder, if you have any questions, you can please be sure to type them into the Q&A section by pressing the Q&A button at the top of your screen. All right, so to start us off, we have a question that says, what are your thoughts about the recommendation to wait 3 to 5 days between introducing new foods to more easily identify the cause of an allergic reaction? In terms of introducing allergens, what guidance do you provide families when introducing allergens for infants not identified as high risk?
Dr. Fernando, do you want to take that one?
Sure. So it's interesting how the feeding guidance has changed. It used to be we did recommend a period of waiting for all foods, but we no longer recommend that we have to do that waiting period or trial period for all foods, but we should for those high allergen foods. And this is something that our team really looked long and hard around the evidence for. There isn't really necessarily the most straightforward answer to this question. So we really sort of almost did a meta-analysis of sorts and consulted with allergists. And our feeding guides recommend a waiting period of 2 to 3 days between high allergen exposure. So that would mean starting eggs, waiting 2 or 3 days before we start another high allergen food like wheat. But for fruits, veggies, no. Uh-oh. Sorry. Go, Rupa, do you want to take it?
We can hear you now.
Okay. For those fruits and veggies, it really is not recommended that we wait, because we're in a flavor window. So we don't want to delay unnecessarily the introduction of these foods. This is a time where we can go pretty fast and introduce a wide variety quickly.
Okay, thank you so much. Our next question asks, what is your takeaway of finding balance between utilizing healthy packaged foods like Once Upon a Farm or Brainiac foods versus fresh fruits and vegetables? Thinking about how these foods can be safe foods because they always have the same taste versus fruits and vegetables.
So I'm happy to chime in. I think there's definitely a place for packaged foods, pouches, more on the go when you're in the car, when your kids at activities, in between certain times. But I think when you're truly sitting down for mealtime, it's such an important place for vegetables and fruits to be on the plate in their natural form. And the reason I say that, I do like a lot of vegetable forward baby food companies out there. But like I mentioned, when we're looking at the data, they tend to be a little bit more sweetened, mask some of those true flavors. So, like Dr. Fernando said, when we're really focused on the flavor window and enjoying the taste of vegetables and fruits, I mean, there's nothing like a crunchy carrot or truly tasting a butternut squash, especially in the fall. And I think there's an opportunity there. But I say, when you're on the go, when you're busy, when you need it, it's there, but in conjunction with whole foods on your plate.
I would agree with that. And I think if we take feeding development in mind, there are ways to use those foods too in ways that still optimize feeding development. For instance, some of these purees I've noticed are more spiced. These baby food companies are thinking about flavor, but maybe they're still smooth. So why not use them as a dip for other finger foods, right? Or as a sauce. So there are ways, I think, to just make sure that we're still keeping feeding development in mind as we're using these commercially available products.
Okay, thank you. We have two questions that are sort of related. One asks if you have a database of feeding specialists that people can refer to. And another asks, do you have any suggestions on how to introduce new foods to a child with autism spectrum disorder?
So I'm happy to take the second half. One, as a practicing provider at UT, we don't necessarily have a database, but we just refer internally to our UT um, speech therapists, which do a lot of work with speech and swallow, especially to identify any feeding issues. But a big database, I'll let Dr. Fernando speak to. When it comes to children with autism and development, I actually spoke to a developmental pediatrician not too long ago who just focuses on autism. And we know that those children, right, they have a little bit more sensory issues, a little bit more texture issues, can have, um, a little bit just not like the flavors of certain foods. So, really getting them involved in the cooking and the preparation process is extremely important. And then allowing, one thing I mentioned, offering foods in so many different forms. So you can do it air fried, sauteed, broiled, baked, steamed, and really letting the child try different consistencies out and see what works with their palate. And that seems to be the best way to introduce new flavors. I know it can be sometimes a little bit more challenging with the sensory issues, but I've seen a lot of improvement with this group of children, especially when they're involved in the process.
Yeah, I would echo that. A lot of the training of our food adventure involves really meeting kids where they are, and that includes children with special needs, neurodivergent children. It is important to take those really small baby steps, and cooking kind of provides that because there isn't as much pressure on tasting at first. We're really just using our other senses to become comfortable. And so we've seen a lot of success and a lot of testimonials from parents who are really pleased with the progress that their children make in a cooking curriculum in school. So I'm a big fan of cooking for all different types of children, especially kids with sensory challenges.
And that's fantastic. And I love that emphasis on cooking, mixing, right? All of these small steps are included, tearing, smelling, sometimes even getting a child used to touching a food, smelling a food, kissing a food, right?
Yes.
That can also be like small steps on the journey to that food acceptance. We only have a few minutes left, so I think we're going to have to wrap things up with our last few slides. But I just want to thank y'all once again for providing us with all this fantastic information. For those of you who are looking to continue your education, if you requested continuing education credits upon registration, please see the information on this slide for instructions. For nursing CEUs, please scan the QR code and complete the required evaluation. Next slide. All right, and we want to thank you all for attending today. The recording, slides, and resources mentioned will be posted on msdcenter.org, and you will also receive a follow-up email with the links to all of these. Please join us for upcoming webinars on November 11th for tips about healthy holiday meals, and on November 20th for Catch My Breath. Thanks again for joining us today, and we will see you next time.